And it's essential to understand who you are dealing with. Otherwise, you're treating them as if they're a potentially normal individual. You're ignoring the fact that they have differences in how they process, how they feel, how they are able to express how they feel. You're ignoring all of that and just assuming, well, if I train you to do these or perform these skills, then I can say, you're like everybody else now. Isn't that the goal? And I'm sorry, but every individual in the world will fight. They have a self identity. This is who I am. Don't ask me to be who you think I should be or want me to be.
Hi, I'm Stacy Neustadt. I am a speech language pathologist and the CEO at Making Sense of Autism, and I'm a student of Susan.
And I'm Susan Golubach. I am a now retired occupational therapist who has worked many, many years after I discovered even my own autism with other autistic individuals. I founded Making Sense of Autism because of my passion to not only understand my brain and how it worked differently, but to try to explain what I've learned to other people so that they're more understanding and therefore more accepting and more accommodating to autistic individuals.
So, our goal is to help you provide the right support without trying to fix autism, but by understanding it. So, whether you're a parent, teacher, therapist, or just someone who wants to learn, you're in the right place. Be sure to subscribe and join us every week. We talk about a new topic. Thank you for joining us today. Each week, Sue and I talk about a different topic, either something I've experienced as a speech therapist in my sessions, or I hear from other therapists. And this week, we want to really talk about when we say we assess a child holistically, what are we actually paying attention to that traditional assessments tend to miss? I know as a speech therapist, I have learned so much from you, Sue, regarding occupational therapy. I keep up on the gut and the brain connection because all of those pieces and the nervous system, all of those pieces they impact our sessions. If a child that I'm working with is dysregulated because they are constipated, I am not going to get anything out of that session. So I feel like we have to look at our kids holistically. So when we are thinking about our traditional assessments and trying to look at an individual holistically, what do you feel like is missing, Sue?
I think we tend to fragment the child into, okay, sensory is purely OT, and emotions are for the psychologist or the counselor. Um, uh, Speech, the head area, okay, speech is for speech therapists. But you don't do anything as far as the hands or the bodies or no, that all of this, we're just fragmenting that individual. And unfortunately, then we're missing huge components that influence, and then we wonder why we're not making progress
Yes.
because we are deliberately ignorant. Well, that's not my territory. I don't specialize in that. I only specialize in this. So send them to this for this and this person for that and this, but nobody's putting it together.
Mhm.
And excuse me, that's how do you think an individual feels like they're a fragmented person? With children, learn this. They certain behaviors with certain people. You have this expectation, and so that's all I'm going to do for you. And you have this expectation, so that's what I'm going to do for you. But I don't do it with anybody else. And
Yeah.
you wonder why they don't apply it to their actual life because they see it only as only no. I'm only do it to please what you want, and what you want is different than what you want, and it doesn't make any sense. The other thing that I've noticed is the tendency when you talk about social. Okay, that is the crux for autism, is the socialization piece. Um, they finally have acknowledged the sensory piece. Okay, if you as a therapist are going to work with that individual as an autistic individual, and you're ignoring the sensory aspect because, well, that's the OT to take care of. You're not aware of how that sensory is influencing your ability as a therapist,
Yeah.
help them achieve goals. No wonder your sessions are not working, or what you teach or train them to do isn't being applied anywhere else. They're doing only to
Yes.
please you at that moment to get out of that session and survive it. You're not doing anything to help us learn to live life as a holistic person, but only as a fragmentation of what you want, and I do what you want, and I don't see how it even relates to me, so I don't use it at all.
Oh, and we see that so much, and I hear that so much about students they know on a thinking level how to do something, but then when they're on recess, they're not doing it. Well, because they're not regulated, or they don't have that inhibition to not say those mean words when they're frustrated. And I feel like I hope in our field, we start to use information from other fields more. So, yes, I realize that puts a lot, and I know that's how therapists feel like, oh, I can't add another thing. But if we don't, like you said, we aren't going to make progress. We aren't going to achieve goals because it's just performance and it's not true development of those skills.
Right. And I'm not saying you need to specialize in all those areas.
No.
You need to be aware of it and
Yes.
how that impacts on their performance in your area. And how hard is it to simply acknowledge, oh, you seem a little out of sorts today, or you look angry, or when you're throwing that, it tells me you're angry. Now, I'm not a psychologist. I'm not going to tell you how to deal with your anger, but I am acknowledging that it is getting in the way of what it is we're trying to accomplish here. Um, and so let's acknowledge the elephant in the room and let's deal with it on what can I do to help you feel better about things so that we can work together. How
Yes.
hard is that?
Yeah, exactly. It's not learning about all these different areas. I know it's easy for me to say because I love resources. I love learning new things, and I know not everybody feels that way. But like you said, if our goal is to help our kids make progress and to learn skills, we have to at least just learn a little bit. And whatever form you like to learn, whether it's a podcast, whether it's a book, whether it's an audiobook, whether it's a YouTube video, just learning a little bit to, like you said, bring that awareness. So the next time your kiddo comes into your session and they refuse to do anything, maybe your brain goes to, they're dysregulated, their nervous system is off today. Or looking at health or looking at the different areas of what is going on. And I do often hear, well, that's not our area. But if it's impacting your session, it is. You're not going to get anywhere if you don't address it. But if you even just take 30 seconds to address that topic and problem solve with the student, then you can get moving, and get to the goals that you want to work on. So that's one thing I love about our assessment forms with the strengths, stressors, and supports. More often than not, a lot of the information I get is very sensory based, very OT based. They love movement, they love sensory, but we do have the communication section as well. And so as well as a section on trauma, a section on their medical and gut issues. So we do look at the child holistically. And like you said, it's so important. So as a speech therapist, obviously, if there is even, the piece of dysregulation. Well, as a speech therapist, my brain goes to, okay, what language can we teach this child to help them get what they need to get regulated? Whereas the OT might work more on like, okay, what does regulate them? And so we work together. So it is so important, even in assessments, to look at the child holistically versus just what do they do in the area of communication? Because then I can create goals, but I'm still going to miss those important pieces.
And it's essential to understand who you are dealing with. Otherwise, you're treating them as if they're a potentially normal individual. You're ignoring the fact that they have differences in how they process, how they feel, how they are able to express how they feel. You're ignoring all of that and just assuming, well, if I train you to do these or perform these skills, then I can say, you're like everybody else now. Isn't that the goal? And I'm sorry, but every individual in the world will fight. They have a self identity. This is who I am. Don't ask me to be who you think I should be or want me to be. And I'm sorry, why do you think parents have a hard time with children who are fiercely independent and want to be recognized for who they are, not what the parent wants from them or for them? I mean, that's human nature. And
Absolutely.
if you're ignoring that individual and the fact that they process and not saying, oh, I don't think I must have explained that in the right way because you seem confused or you're not responding. Um, Acknowledging what you see and say, okay, how could I do a better job? Not, oh, you failed the response, so you don't get the treat that I had promised you um, until you do what I asked you to do.
And that's not going to get anywhere other than behaviors or just a compliant kid who with no self-awareness, which we don't want that either. So,
Yeah, even being compliant doesn't mean they will use what they've learned.
no,
They're in a
absolutely.
survival mode. That's how
Yes.
I grew up, surviving.
Yeah.
And what I didn't know into my 50s and only discovering what a child of 3 should have been made aware of. Uh, yeah, because no one recognized. They treated me like I was like everybody else because they didn't want me to feel different, which implies different is bad. And therefore, my whole self-esteem was in the toilet. That no, I can never measure up to other people's expectations of me. So I would just be angry at them. And to praise me for not being who I am would just anger me even more.
Oh, I'm sure. And I'm sure there's a lot of people listening who might think about, is that what's happening with my client? Is that what's happening with my child? Um, we do have a shortened version of our strengths, stressors, and supports profile. And I highly encourage both professionals and parents to use it because, as you mentioned, by using it, we are discovering more about the individual. And I feel like as you fill it out, these are probably things that you see every day or are used to seeing, but you didn't put it into these categories of strengths, potential strengths, barriers, triggers. Once you put it in those categories and you see our explanation that barriers are things to get around, the potential strengths are goals that you're going to develop, it's what they want to learn, and triggers are things to avoid, not desensitize. You are going to have a different lens. So we'll put the link below and in our blog, but I highly recommend you checking out our free strength stressors and supports profile shortened version. If you're a parent interested in having your child assessed, we do provide coaching services, which includes the full assessment along with our soft skills. And if you're a professional, we will be releasing the full strength stressors and supports course that includes that assessment and our soft skills assessment at the end of February. So you can get on our wait list for when that opens. But we hope that you too want to look at the child holistically, whether they're a child or adult, looking at them holistically. So not only do they increase their self-awareness, but you understand them better as well. So thanks for the information, Sue.
Well, thanks for asking, Stacy.